The vaccine rollout is starting to pick up, but it is still going to be a long road.
And at the same time, the CDC says the UK variant of the coronavirus could be the dominant strain of the virus here in the U.S. by March.
So how do we protect ourselves from that variant? Well, some people say wear a better mask. Dr. Zorba Paster joins us tonight with more on that.
Hi, Zorba.
Hi, Zorba. Good to see you.
Good to see you guys.
So what does a better mask mean?
Well, first of all, the most important thing is the most important mask is the one that you have with you. I think that's a really important thing. There still are many, many people in the state who, for some reason, don't believe that masking up helps. And all you have to do is go from one county where there'll be no one masking up and another county where everyone is. So wear a mask is the most important thing. Now, the cloth masks, such as the bandana, are probably the least effective. They're going to do something, but they're just not engineered the right way. Now, if you wear a mask like this is a typical surgical mask, believe it or not, very, very lightweight, but these are actually quite good. They're actually designed for that. And in our office, this is actually the mask that we have to wear. We can wear an N95, but N95s are really, really hard. They're difficult to breathe through and they're hard to get, but N95s are, of course, are the best, but these are actually very good masks. So what I recommend people do, they Google the best mask, they look at the New York Times, Wall Street Journal, Johns Hopkins, Mayo Clinic, and do that. And if they've got a question, especially when they're indoors and they're around other people, you can wear two masks. So you can wear a bandana mask and put this on top. You may look funny, but frankly, nobody's going to look at you strange when you wear a mask anymore. The most important thing is to stop those droplets, socially distance, and be very careful when you're inside and minimize the amount of inside exposure. Because as you say, it's a long road before we're all immunized with the vaccine.
So is the variant can it penetrate better, or?
Well, the variant does not appears to be more aggressive in terms of its ability to get into us. It appears to be absolutely easier to spread from one person to another. But it appears that the immunization works just as well for the variant. And if you look at influenza, the same thing occurred in 1918. You had 1917, 1918, and 1919. And in the middle of the influenza epidemic, there was a stronger strain, if you will, that came in. And then by the next year, it actually died out. But the present one means it's going to spread easier. But the vaccine at this point appears to be just as effective. And I say at this point because right now all the data isn't in, but the people I've talked to at Johns Hopkins have said the vaccine works for this one just like the last one. This one is just more likely to be spread, which means it's even more important to wear your mask.
People over the age of 65 learned this week that they're eligible now to receive the vaccine. What do they need to know, folks that are watching
Well, first of all, what they need to know is they need to go to the website or they need to contact their health care provider and say, when am I going to get the vaccine? How do I get on a list? Is there a list? Because believe it or not, different clinics are doing it in a different way. And I spoke to the governor's office today, and the governor's office said everyone over 65 should be vaccinated. We don't think there should be impediments and say you need diabetes, hypertension, and other medical problems, because we know the greatest risk factor for death is age. And we also know that even though you think you can quantify that diabetics are more likely to die, the answer is we don't know if that's the case. And so the answer is we should get that out as soon as we can. And the important thing is Anthony Fauci thinks we can do 100 million in the next 100 days with federal support. We've got to get the vaccine out. And part of our vaccine is being held back now for assisted living and nursing homes. And frankly, that's where a lot of death occurred. And it's important to vaccinate that group as soon as we can because they are clearly at the highest risk.
All right, 270-9933 is the number to call if you have a question for Dr. Zorba Paster. We'll get to your questions right after this.